Hello, my name is Dr. Akhil Chopra. I'm one of the senior cancer specialists working here in OncoCare Cancer Centre in Singapore. Today, I'd like to take this opportunity to talk a little bit about liver cancer, a very aggressive and deadly cancer. So, what is liver cancer? The healthy liver cells, also called hepatocytes, develop into cancer cells. This accounts for 85% of primary liver cancer. There is another type of cancer that arises in the liver, but it starts from the cells of the bile duct, and this is called cholangiocarcinoma. In addition, cancers that start somewhere else in the body can spread to the liver, one common example being colorectal cancer. In this case, this cancer is considered to be a secondary liver cancer since it has originated outside the liver. How common is liver cancer? Well, at least in Singapore, it continues to be the fourth most common cancer in males, accounting for 7.5% of all cancers diagnosed, as per the Singapore Cancer Registry. In addition, liver cancer is the third most common cause of cancer-related death in men and the fourth most common cause of cancer-related death in women in Singapore, reflecting its aggressive and deadly nature. However, the good news is that the overall incidence of newly diagnosed liver cancer is declining over the past 2 decades in Singapore, which is likely a combination of many factors including better treatment for chronic hepatitis C, improved immunization rates against chronic hepatitis B, as well as adoption of healthier lifestyle by most people. So what causes liver cancer? Well, liver cancer usually develops in a damaged liver or what we call a cirrhotic liver. And this damage to the liver can be from many causes, but the more important and common ones being infection with hepatitis B or hepatitis C and excessive or prolonged use of alcohol. Fatty liver is also becoming an important cause of liver damage, especially in the West. A damaged or cirrhotic liver can lead to development of liver cancer due to accumulation of multiple genetic defects over time. I'm often asked, what are the symptoms of liver cancer? The symptoms of liver cancer can be relatively non-specific, meaning the symptoms may be seen in other conditions as well, such as underlying liver damage. In addition, during the early stage of liver cancer, there may be no symptoms at all. Patients may feel a hard mass in the upper right part of the abdomen. Also, in advanced stages of liver cancer, patients may develop jaundice or yellowing of the eyes and the skin, profound fatigue, weight loss, reduction in appetite. But as I said, these symptoms are relatively non-specific. Can we screen for liver cancer? Yes, regular screening may diagnose liver cancer early. Screening is usually done in patients who have underlying liver damage or liver cirrhosis, either due to chronic hepatitis B and C or due to cirrhosis from other causes such as prolonged and excessive alcohol intake. Screening usually involves regular ultrasound scans or CT scans of the liver and blood tests of cancer markers such as alpha-fetoprotein, which are done every 4 to 6 months. How is liver cancer diagnosed in someone we are suspicious of having liver cancer? Well, it's usually done with a combination of tests and investigations. These include imaging tests such as ultrasound of the liver, CT scan, which is usually triphasic or multiphasic CT scan, or an MRI of the liver with contrast. In addition, elevated cancer markers in the blood, such as alpha-fetoprotein, in the background of someone with known risk factors for liver damage, such as chronic hepatitis, is usually sufficient to make the diagnosis of liver cancer. Rarely, a biopsy of the mass in the liver may be needed if we are not completely sure that this is hepatocellular carcinoma. Once a diagnosis of liver cancer is made, how is this managed? Liver cancer management is very complex and usually requires the input of multiple specialists. These include specialized liver surgeons, interventional radiologists or interventional oncologists, hepatologists, medical oncologists like myself, and sometimes nuclear medicine specialists. At the OncoCare Cancer Centre, we try to make sure that every patient with newly diagnosed liver cancer is discussed by this team of multiple specialists so that we can ascertain the best treatment option for our patients. The management of liver cancer can include surgical removal of the cancer, especially in the early stage of disease, sometimes liver transplantation, local regional therapies that include TACE, targeted radiation therapy to the liver tumor, radiofrequency ablation, and other similar therapies. For advanced liver cancer, many new treatment approaches are today available, and these include targeted therapies as well as immunotherapy. In addition to treating the liver cancer, we also make sure that we take care of the underlying damaged liver, and in case patients have untreated chronic hepatitis B or C, this is treated as well in parallel with the treatment of the cancer. At the OncoCare Cancer Centre, we are indeed privileged to work with highly specialized and senior liver surgeons who assess the patient, the underlying liver cancer, as well as the underlying liver reserve in a comprehensive manner. Latest surgical techniques, including laparoscopic or robotic techniques, may be used depending on the situation. Unfortunately, sometimes the liver cancer may be too big or too advanced to remove surgically. In this situation, local regional therapies such as TACE may be used. TACE or transcatheter arterial chemoembolization is a procedure where an interventional radiologist or an interventional oncologist would aim to deliver a high concentration of chemotherapy directly into the tumor through the blood vessel that is feeding the tumor. Sometimes selective internal radiation therapy or SIRT is used to treat the liver cancer. This is done with SIR spheres, which are yttrium-90 resin microspheres that deliver radiation in the form of yttrium-90 to the tumor cells. The properties of these microspheres mean that radiation is selectively given to the tumor, maximizing the killing of the cancer and minimizing the effects on the healthy liver cells around the cancer. If the liver tumor is small, usually less than 3 cm in size, it can also be treated by a procedure called radiofrequency ablation. This procedure, usually done by an interventional radiologist, a probe is inserted into the tumor under ultrasound guidance and ablated, usually with the help of a small electric current. This procedure is very effective, especially for small tumors, and sometimes can be used in old patients where the risk of surgery is very high. Unfortunately, sometimes when we diagnose the liver cancer, it's already in the advanced stage. In the advanced stage of liver cancer, the cancer cannot be removed by surgery or treated by local regional therapies. In this situation, we usually use either targeted therapies or immunotherapy. A lot of exciting research has taken place over the past 10 years, and a number of new drugs have been approved by the FDA and other regulatory authorities to treat advanced liver cancer. In the past decade, a number of targeted therapies have been approved by the FDA and other regulatory authorities for the treatment of advanced liver cancer, both in the first line and the second line setting. These include sorafenib, lenvatinib, cabozantinib, regorafenib, and ramucirumab. Immunotherapy drugs essentially work by activating the patient's own immune system to kill the cancer. In a way, a natural way to kill the cancer in the body. The two currently approved immunotherapy drugs in the treatment of advanced liver cancer include nivolumab and pembrolizumab. These drugs are antibodies against the PD-L1 protein that is involved in the immune pathway response to cancer. Many more clinical trials are ongoing that are looking at new immunotherapy drugs as well as combination of existing immunotherapy drugs with targeted agents. I am very optimistic that these new drugs and new strategies will greatly benefit our patients and improve their outcomes. I'd like to summarize by saying that liver cancer is a deadly and aggressive cancer, and the optimal management of this cancer requires the input of multiple specialists. At the OncoCare Cancer Centre, we offer the latest treatment strategies and medications to treat liver cancer and improve the outcome for our patients. Thank you.